Like everyone else, I am really worried about Obamacare subsidies going away. I'm also worried that people that are on private insurance are going to see double, if not triple, of their insurance premiums go up. Also worried about people on Medicaid being dropped from the program. But not only that, the last safety net is the community health center. Right now, the community centers only have 3 months of budget expenses to operate. In a normal world where Trump is not in charge, there was bipartisan support, Republicans and Democrats, that wanted these community health centers open, especially in rural areas. But it's a totally different world right now. We are in the upside down universe, and Republicans can care less. According to Orlando Sentinel, half of the community health centers have fewer than 90 days of cash on hand, and one quarter operate with margins below -4%, according to the audit. One of the reasons why this is so is because Trump froze many of the federal grants that go to these community health centers. And because these grants were taken away, it actually caused some clinics to actually shut down, and some of them just reduced their hours. And on July 4th, the broad domestic policy law that Donald Trump signed in, it was to increase the number of uninsured patients seeking care at healthcare centers. How are you going to do that? How are they going to be able to operate? If you're going to have millions upon millions of people that are going to lose their medical health care benefits on Obamacare because they cannot afford to pay the new insurance premium. So you want the public to use community healthcare clinics, but you're taking away federal grants that go to the community healthcare clinics. I don't get it. And now you want to overwhelm them coming January 1st. Now, due to the government shutdown, it has prevented Congress from renewing the Community Health Center Fund. That expired September 30th, and it provides 70% of federal funding. Now, the centers are also worried that the new Trump administration policy will bar them from providing care to some immigrants, which would force them to dedicate scarce resources to now verifying patients' legal status. A lot of clients that you see through the community health center are like asylum seekers, DACA, immigrants that are legally here. So let me just summarize this conversation for the MAGA people, okay? If you have Obamacare and you have no subsidies, your insurance rates are definitely going to go up, double or triple the rate. Okay. Number two, if you have private insurance, your private insurance is definitely going to go up, and it could also double and triple in rate. If you think that you qualify for Medicaid, the chances of you getting Medicaid is slim to none. In 2026, at the end of the election cycles, because the Republicans did it just like so, because they wanted you to make sure you voted for them, your Medicaid is probably going to go away. And then you have these community health care clinics, which is the last safety net in the community, that are going away because they don't have the funding, because he took away federal grants, and because the government is currently not open. And even if they do reopen, who's to say that money is going to be there for them? When I tell you that this government wants you sick and tired, I am not lying. So this is a real big concern, especially in the red rural areas. But you guys, you voted for this. I am trying to have a heart, but you voted for this. You guys have a blessed day.